So when you're pregnant and you're getting a facial, you might find that your skin's absolutely glowing and you've got no problems at all, no spots, no breakouts, but sometimes your skin becomes very irritated, so it can go from one extreme to the other. So facials are absolutely fine to get, just be aware that you want to check that there are no ingredients that could irritate the skin. Make sure if it's aromatherapy oils that are at a low concentration, and if you're in any doubt at all, ask your therapist. So anytime you get an eyelash or eyebrow tint, you have to get a tint test 24 to 40 hours beforehand, just to make sure that you don't take a reaction. When you're pregnant, this is very important. You really need to make sure that you do this because your sensitivity changes, your body's reaction can change. Different therapists will operate different rules. Some insurance companies won't cover tinting during pregnancy, so make sure that if you're a therapist, you check with your individual insurance company. When you are being tinted as a client, phone up your therapist, make sure you let them know that you're expecting, and they will tell you whether it's okay to go ahead or not. And if you just close your eyes just now, you'll see that when you are pregnant, you sometimes find that you actually get more hair growth than normal. Your eyelashes can get longer and thicker, your eyebrows can be the same. So you might find that during your pregnancy, if you are getting tinting done, everything looks great and everything looks really thick and luscious. Don't be worried if after, when you've had the baby, your eyelashes or eyebrow hairs thin down. That's a normal reaction, and once your hormones have stabilised, everything will go back to normal. Waxing during pregnancy is absolutely fine, so long as you understand that you might be a little bit more sensitive than normal. What will happen is, say for instance it's an eyebrow wax, it's normal to have a redness reaction, but if you're pregnant you might find that it's more red and more irritated than normal. So just be aware that it is a heat treatment, your skin is sensitised. Getting waxing done anywhere in the body should be fine. Just let your therapist know and be prepared that the skin might be a little bit more sensitised, it might be a little bit more uncomfortable, but everything will go back to normal in the same amount of time afterwards. So about 2 to 4 hours later the skin will settle down, and about 12 to 24 hours later you're back to normal. So, most common thing that women want to prevent in pregnancy is stretch marks, and this is Vineeta's third pregnancy. She's 17 weeks along and so far she's not had any stretch marks in all of her pregnancies. So what you can do is use products such as this one. This is a Sanctuary Stretch Mark Oil, and you can use it every day after your bath or shower and just place it on areas where you typically develop stretch marks. So on the stomach, on the hips, sometimes you do get them on the breast area, under the arms or on the knees. So just a tiny little bit, rub it in, it feels really nice, it's quite a dry, light oil, and it can't stop them occurring, but it can minimise the chances, and if you do get one, the moisture can make it look less angry and less irritated than it otherwise would have been. By doing this, when they do fade, they'll fade to a white or silvery shade, and it won't be as obvious as if you just left them and did absolutely nothing with them. So just a little bit about body treatments in pregnancy. Jen is 6 months pregnant, so she's got a lovely neat bump here, but treatments that you'd have to be careful about are electrical treatments, so you don't want anything that's got electrical currents or pulses within the treatment when you're pregnant. Heat treatments, you don't want to raise the body temperature, so you want to avoid those completely, or speak to your therapist in case there's anything that's been adapted for pregnancy that's safe. You are okay for certain types of massage. Again, speak to your therapist. It depends on your trimester and it depends on the products used. Aromatherapy can be used, but certain oils can cause certain reactions in the body, so be very aware. Overall, just make sure when you go to any salon, even if you've just discovered that you're pregnant, tell them how far along you are, any allergies that you currently have, and ask them to tell you if they know that this treatment is safe to perform on anyone through pregnancy. Other treatments that you can get when you're pregnant, you should be able to get your manicures and pedicures, no problem at all. Again, if they're using any heat treatments that introduce heat into the area and it stays within the area, you should be fine because it's localised, but in general with pregnancy you don't want to increase the heat within your body, so you might even just want to avoid, if you were getting heated mitts or booties, just avoid that from any luxury treatments. You can get maternity reflexology, and standard reflexology can also be fine. Just again, check with your practitioner. But there's absolutely no harm in using products such as this one. This is Sanctuary Collagen Boost Body Butter. You can use it all over the body, but you could even ask someone just to give you a lovely little foot rub with it. And all it's going to do is keep your skin nice and soft and keep everything nice and relaxed, and any sore feet get soothed. So that's maybe something that you could ask someone that likes you to do every day for you. So this is just a little demo of how you could position a client if they were quite far on and it wasn't comfortable for them to be positioned on the treatment bed. Lots of different ways that you can sit your client. If they do want to be on the treatment bed, sometimes they can lie on their side. If they've got quite a small bump and it's comfortable, you can still lie them on their stomach and you can expose the back and work on the back area. You do also get some treatment beds now that have an area removed so that the stomach can sit quite comfortably in it. But this is quite a simple way to place your client if you just want to work on the back. Their stomach's quite big now and it's comfortable enough for them to sit this way. So have them facing the back of the chair, pop a pillow in so that they can manipulate the pillow to suit and it's very comfortable. They can sit and rest their head however they like, drop their arms down if they want to. The full back would be exposed, and then you can sit in a stool at a comfortable position and you can work and do the normal treatment movements as you would do normally when it's on the treatment bed. Main concern is that your client's healthy, they're comfortable, and you're using products that are correct for a pregnant client.